to the Thom Hartmann Program. I've got Michael Lighty of National Nurses United still on the line. We're going to take one quick call from Carol in Michigan. Carol, please be brief in your question so that we give time for Michael to answer it.
Hi, I'm calling about the drug prices in this country, and I know it's not the topic you're on right now, but my doctor has advised me to save money. I can go to Canada, and I need some advice as to a reputable Canadian drugstore I can work with online. It's all left in my lap. My drug prices are so high that I will reach the donut hole in another 6 weeks. And this year, there's a lot of time left in this year. So I was just wondering if there's anyone out there who could steer me in the right direction.
So, Michael, why don't I take this one?
Yeah.
Carol, I just want to start with just one thing, which is like this. First of all, I like your doctor. I like your doctor for seeing that if you can't afford the drugs that he's prescribing, they're not going to help you. They're of no benefit to you if you can't afford them, and that it's immoral to lock people into a system where they can't afford the medicines that they need, and so to recommend that you look to break out of our system. Now, if you look it up, personal importation in this country is allowable. You're just getting prescribed drugs, the drugs that you're prescribed, and personal importation is a sort of gray area in the FDA's regulations. So I can't tell you anything to do or not to do, but I can point out that there are some resources out there where you can do research, and one of those is Pharmacy Checker, pharmacychecker.com, or if you just Google Pharmacy Checker, that's a research tool that you can use to research different online pharmacies and their reputableness. So that is something that I think you could look into, Carol. And, you know, again, I think at the policy level, what we're trying to do is create a situation where your doctor never has to think about, you know, really your pocketbook as part of the prescription for health. Because right. The system that we want to build is you need something to stay healthy, and then you get that thing to stay healthy because we have a system of health care. And we got to keep marching towards that, Carol. And, you know, we're going to do, I do think we're going to fight multiple fronts at the same time. So we're going to be pushing. We think that full importation from Canada and other countries, a bill that Bernie Sanders has put forward, is definitely something that we want to get enacted into law. And we want to build a system where pharmaceutical corporations, I mean, what I want to do is I think we should just seize the patents from them and hold them in public so that there is never these corporations that are just profiting off the restriction of access to the drugs that doctors are prescribing. But Carol, I want you can check out that resource, Pharmacy Checker. You can do research on that portal. And I do hope that in discussions with your doctor, you figure this out and that you and I can build a better system based on justice instead of the one that we're living in right now. So thanks so much, Carol, for your call.
Thank you.
Welcome back to the Thom Hartmann Program. Still on the line with me, Michael Lighty from National Nurses United, a leader in the fight for improved Medicare for all, everybody in, nobody out. Michael, I want to go sort of big picture, but strategy here as well. You know, I think what you're doing in California and the nurses are doing in California, pushing that fight there. And around the country, there are these state-based efforts going on, as well as the federal effort. And I think the key is when we can work these in alignment together and find a sort of a complementary nature of it. You know, the Saskatchewan model that Thom talks about all the time when he's talking about a road to Medicare for all in this program. You know, if California is massive, if California does it, I mean, it's like the rest of the states just have to do it. But can you talk to us about the path? What do you see as the path, and how can people get involved?
Well, the path to federal single payer as a political movement does run through the states. And Tom's right, you're right. California's got the sixth largest economy in the world. We got almost 40 million people here. We're bigger than other countries that have done national health care. We clearly have the resources to do it. We have the precedent in terms of the climate action program, inadequate, but cap and trade is presidential in the United States. Even on this issue of gun violence, we just heard the governors basically tell President Trump that it's going to be up to the states to come up with different approaches. This is how it's done often in major policy in the U.S. The Democrats control the state legislature. They have the governorship. The front runner for the next governor of California, Gavin Newsom, is running in support of our single-payer bill, SB 562. Ben Jealous is running in Maryland. Kathy Glosson, a registered nurse, running for governor of Iowa on Medicare for all. We have legislation in place in both those states, Healthy Maryland, Healthy Iowa. Iowa sets the table for the political conversation. Again, we can frame the debate and put people on the ground, moving politicians and moving people to make this the defining issue. And so I really think that all of this works together, Alex, so that come 2019, we should be in a position to have a real fight over Medicare for all in Congress. That's completely achievable. And talk about big picture, this is not a time for can't. This is a time for will, specifically political will, and specifically among the Democrats.
I couldn't agree more, Michael. And the stumbling blocks that I see, you know, first of all, I just want to, I have been in this movement for a long time. I worked at outreach clinics in Chicago, Illinois. I don't come to kind of this political world through politics. I actually come to it through working in clinics and seeing our broken system and saying this is immoral and we need to build something better. I've never seen, I'm really heartened by where we are in the path to improved Medicare for all. So like what you just laid out there, I think we're further along than I've ever seen before. And so we just are almost there at this critical mass where it's going to be inevitable. And that is what we need to change. The sort of political, I say the money that pours into this town, they don't just fight against a specific bill or a specific, policy. They also, they fight against aiming high. They actually want us to aim low. And they do it through this kind of narrative of inevitability, right? Well, it's inevitable that if you try to do that, you're going to fail because there's going to be this backlash, right? They have all these stories that they tell. And where we win in the popular movement, in a movement that's based on what the people want, is when we can claim that inevitable narrative. And I think we're close. I think we just keep on marching and demanding in every state in this country, we build a movement demanding health care as a right. And I think the nurses are taking, as always, an immense leadership role in carrying that torch. Can you tell people how they could get involved? Maybe they're in a state, because Tom's listeners are everywhere, and I love that. I look at my phone tree here, and they're calling from everywhere. What if people are in, let's just say, like a deeply red state, like Norma from Alabama who's calling in? And what can they do to take part in this fight? What can people do all over this country to fight for health care as a right?
The most impactful thing that we could do is have red state politicians hear this demand, because there is a huge chunk of the working class base in Alabama, in Georgia, in I was just in South Carolina, I can tell you it's there, that wants this, that demands this. And really, we're not talking about, okay, we're going to change someone's partisan identification. But in red states, this can have a huge impact. Workers, let's face it, either we're going to get a subsidy to buy inadequate insurance, or we're going to have a guarantee of health care through an improved Medicare for all. The choices are pretty straightforward. We're going to be on a and I think people need to hear, politicians need to hear from people and make that demand. We can go to the campaign healthcare.org website or healthcarenow.org. These are grassroots organizations that have activists all over the country. I can tell you, in every state, in every big city, and even in some rural communities, there are meetings weekly or monthly on improved Medicare for all. There is infinite ways to get involved. Write a letter to your editor. Get out of this frame of affordable health care or affordable insurance and make the demand. Health care is a human right. Health care is a public good. And many folks, many Republican voters are tired of others getting subsidies. Maybe they make a little bit too much money to qualify. Again, improved Medicare for all includes everybody. Everybody shares responsibility to paying for it, and everybody is in and benefits from it. That is unique in America. We need programs. We need people to talk and find places where we can all come together. This is one of them.
Michael Lighty, thank you so much for joining us on the Thom Hartmann Program. And as you say, it's the universality that is its strength. We need a system that has everybody in it. Michael, thanks so much for joining us here on the Thom Hartmann Program.